Okay. Welcome everybody. My name's Dr. Lederle. I'm a chiropractor based in Knysna. I've been in practice for 15 to 16 years in Knysna, and I've been qualified about 20 years and following a health-based occupation pretty much before I started studying. So for about 20 years. My mom's a physiotherapist, but has always been very eccentric in her ways and not new age thinking, but very wellness in her thinking. And I've learned a lot of what I know. I'm going through a few basic things on what my beliefs are from a health perspective, from a wellness perspective, how I define certain things, and how I would like to have a look at see how we can move forward from a user experience perspective specifically to health. So I'm going to have a look at a few definitions because it's very important that you understand what I'm saying when I talk about wellness and when I talk about health. And one of the major things we need to have a look at, and I'm going to start with what I call the 3 parts to health. And the medical fraternity and everybody in the field of wellness, health, intervention, that sort of thing, can be grouped into 3 basic groups. And it's very important to understand this from a philosophical point of view so that we know what we're going forward with. So if we have a look at those 3 groups, at the top you'll see there's wellness, and what's being called epigenetic care. Then at the bottom, you've got crisis care and disease care. Now, I want to talk about these 2 first. So if we look at crisis care is when a person is in a car accident, they've had a stroke, they have cut their leg. It's crisis intervention is needed, often done in a hospital, and it's crisis because it's often life-threatening. So those are they call crisis care. So the next is what I call disease care. This is when a person has been diagnosed with whether it's a life-threatening illness or something a little bit less threatening. We have a look at blood pressure, heart disease, cholesterol, anything like that we call disease care. So anything that has a name. And it's very important to have a look at this. The medical fraternity often uses 2 very basic interventions to help this. And their port of call is drugs, so pharmaceutical use or surgical intervention. And it's these 2, it must be very, very clear that when we have a look at these 2, the crisis care and the disease care, are very, very necessary parts of the big model of health or wellness. So I'm not against it. I am against the unnecessary use of drugs and surgery. But then what I want to do is have a look at the medical fraternity and the pharmaceutical industry call that healthcare. And I have a major problem with that, because if you call crisis care or disease care healthcare and actually sick care and sick intervention, it is not going to lead to a healthy society. So if we have a look at that, disease care, drugs and surgery, it was creating health or making people healthier, I would be it to my children. And that's the difference between disease care and wellness care. So when we have a look at wellness care, because this is the field that I want to have a look at deeply, this is where I work. Wellness care or epigenetic care is anything that you can do to the body, whether it's or any form of intervention. I'm a chiropractor, but if you have a look at massage and classical acupuncture, all of that is aimed at getting the body to function better. So getting the body to build up, to be more resilient, to regenerate itself so that it gets the body functioning better. There are various definitions of health, and when we have a look at health, my way of looking at health in a very simple way is how efficiently the body is functioning and we talk about function and various measurable ways that we can look at function, and then having a look at what can maximize function and how the body can adapt to the environment from a stress point of view. There are various modes of stress that the body needs to go through and adapt to and deal with so that it's not going to break down, and that the person or the body can carry on in life. So that's a major thing to have a look at from a wellness perspective, is, and not to confuse wellness care with disease care. So when I've thought about seeing the user experience, there are going to be various ways that the future and patient-centered care is going to be utilized in all three of these methods. I'm going to be speaking more about the wellness thing, and I may speak a little bit about the problem disease intervention and disease care. So when we have a look at the major problems that I see in the world today are not the development of new drugs, the development of new interventions. My greatest insight is, and hopefully I can share this, is that the biggest problem is to lifestyle. The World Health Organization is very clear that in South Africa, and this is a very conservative estimation in my view, that 60% of South Africans, just listen to this interesting statistics, 60% of South Africans are going to die prematurely, that's young, die young, prematurely from preventable disease. 60% of South Africans are going to die prematurely from preventable disease. Preventable disease is what I want to focus on, because if it's preventable, should we not be spending all our time, effort, resources on prevention? If you can change 60% of the disease in the world just through a responsible lifestyle, that is going to make a tremendous difference in the outcome of people and the people's lives and their fulfillment and their aims, and unnecessary suffering. I see unnecessary suffering all the time because people are not taking responsibility for their health. And there's even a greater thing underlying that, is that people are not aware, firstly, that they may be getting sick and ill, and they're also not aware of what they need to be doing. They don't know their lifestyle needs to be in order to manifest a healthy body that they can move forward in their life and get true fulfillment and joy and achievements in life. So I want to look at some interesting statistics that also, I can't stand that a lot of the medical statistics and stuff are based in either the States or in the UK. So I've had to dig far and wide to find specific South African statistics. So here's something very interesting. Discovery did some research through Dr. Craig Nossel of their staff. And what they did is they asked their staff whether they thought they were healthy. And then they did some research into what they were doing with their lifestyle. So in Discovery, 67% of the people interviewed thought they were healthy. So once again, just think about the number. 67% of the people thought they were healthy, but 80% did not eat enough fruit and vegetables. Okay. 78% didn't exercise enough. 61% were overweight or obese. 61% were overweight or obese. And 67% of those were stressed. Now, if you ever look at those four things, not eating enough, not exercising enough, and stress, those are the three main contributors to the preventable disease. And most people, the problem is they don't think that they're sick. Their trajectory, they think, if I'm asymptomatic, as if I'm not sick, I haven't got a diagnosed disease, that I'm healthy. And it's a big misnomer. If you're not sick, it does not mean you're healthy. So once again, it's just a dogma or a stigma that people have that they are not aware that their trajectory is not good. Remember, 60% of South Africans are going to die young, and that's scary. I think it's even greater, but we're going to go with what the World Health Organization says. Now, there's certain culpability and responsibility that people in powerful positions and in education positions need to have a look at, and that is that the pharmaceutical industry has pretty much a monopoly on healthcare. And remember, I say healthcare because they call it, I call it disease care, and very, very little in terms of educating people in lifestyle. Many of my patients come to me and they said, well, the doctor says I'm stressed. And I said, okay, cool. What did the doctor say? Well, he said I must take it easy. I'm like, oh, wow, how much of a difference has that really, really made? Well, obviously not. So there needs to be deep, meaningful conversations about this. So if we're to have a look at making a significant shift in the health and the wellness of South Africans moving forward, we need to have a look at two main things. There may be more. Number one is education. And education really needs to be a major thing that we have a look at to get people to understand their responsibility in it. A lot of people give the responsibility over to the medical fraternity or to their doctor or to their medical aid, expecting that they're going to get looked after. And it's not entirely the responsibility of the medical or the doctor, but there's definitely a culpability or a responsibility there. So that's education. The second thing is, in terms of the lifestyle, most people, if you ask most people, they understand eat more vegetables, exercise more, and then have a look at stress management. People know this. So this is a major thing, but they don't do it. So there's a major gap between what people know they should be doing to be healthy and what they are actually doing. And it's evidence in that research I just showed with Discovery. Now, the gap between that is very murky water because there's belief systems about people, there's self-respect and self-reliance and self-responsibility, which I think is very, very weak in terms of the character that people have. So a lot of my training goes into that. You know, eat more vegetables, exercise better, and stress less, or manage your stress. People know that. So I need to get people to action that. And the problem is to get your shoes on in the morning and get the hell out of the door and get moving. That's not easy. People also then don't understand the trajectory. What that means is what the difference is if they're making decisions, what their life is going to look like in the future. So, and it's a very difficult place to work in because it's not something that you can just plug and play. I've been developing this program with my Inspire program with the corporates and deep introspection into health and responsibility for 3 to 4 years now, and it's not simple to have a look at, but we're getting some breakthrough. So when we have a look at the future of the user experience, there are a few things that I want to have a look at. So we've already spoken about reactive versus preventative care. I think if one of the other problems is that the medical fraternity should not be held responsible for education because they're interested, and unfortunately the pharmaceutical industry are it's a business. So I don't want to rely on a pharmaceutical company that's going to make money out of me actually being sick. Now, I don't want to rely on them to get me healthy. There seems to be a serving of two gods there. So I think the responsibility needs to go with a person who's epigenetically or wellness orientated. And that's a big beast to come up against because the medical fraternity, like I said, have the monopoly on it. So when we're having a look at it at user experience, there are a few things that I see as a challenge. A lot of the apps today, you get the wellness apps, and there's some great applications out there to track and to inspire people to make the changes, to eat better, exercise, and stress less. At the same time, there's a lot of work that needs to be done to have a look at helping people build their responsibility with that. So all the apps are helping with those three main things, but very few of them are actually helping to stimulate people to make the change. And there needs to be some interactive way people are going to be building their self-esteem, their self-respect, and that they're actually going to care for themselves. There's a very, very low participation percentage in people taking their medication. I heard something very interesting about people and how they look after pets. And I'm not sure exactly what the stats were, so I speak loosely here, but apparently if a person takes their pet to the vet and they have they prescribe certain medication, that they're about 95% efficient in or the very good friend of mine who's in a company that competes with Discovery. He said that when you let's take diabetes risk, if they do a test, people are then 50% compliant, only 50% compliant to go get a full test. Of that, only 50% of those people are going to get the medication. And of that, only 50% of people are going to be compliant with the medication. And that's a major thing. If you have a look at that, that's 12.5% of the people are actually getting the proper care. And this has got nothing to do with things that prevent them. So it's got nothing to do with affordability. So with that, we need to have a look at what prevents people from doing that. And once again, I say it's murky waters because we're looking at psychology and we're looking at belief systems, which is the deep dark hole to go. And I mean, I've been doing a lot of introspection for myself because, I'm such an expert at health and wellness. Do I get everything right? Absolutely not. Make sure that I look after myself and my family and my children, but I don't get everything right. So I've had a look at this, and one of the things that I believe is a driving force in this is that people don't care for themselves enough. So to get someone to give a damn about themselves, once again, is going to be a major, major challenge. And that's why I think a lot of the forward movement from a user experience is to get people to believe in themselves, to have a look at visualization processes into the future. I use that a lot with my patients. I say to them, if things carry on like this now, what does your future look like? And never is it like, oh, yes, my future looks great. They all understand that there are implications, but then they still go out and change very little. But when you start to plant the seed and to look after people and their processes and their visualization in the future from an optimistic point of view, okay, if you did do those three things and eat better and exercise more, what would your life be like? And we turn that into an emotional process so that people get really deeply affected by this, and that they then have like a fire switch on inside them. That's why my program's called Inspire. It's about inspiring people and doing things to get them to switch on and take their health and their life seriously, to really make a shift. And once again, what I've realized is people don't make dramatically huge shifts that are sustainable. We get people to make incremental changes so that they can have a look at, everyone knows the power of compound interest. If you make a 1% difference every week, just every week, that's a 52% difference a year. And even if it's a 1% difference in your nutrition a month, that's 12%. I mean, if you ask any investor what a 12% increase in your portfolio will be in a year, they'll say, yes, that's a great investment. So moving forward with user experience, I really think it needs to be very interactive. We need to find ways to gamify lifestyles and to incentivize people, but it needs to be not cheap incentives like prizes and I mean, that stuff works for certain people, and we need to have a look at that, but also to have a look at deep, meaningful incentives for people, and to guide people into that is where I think the greatest challenge from a wellness perspective is. All the guys are going to be thinking of very clever things with medicine and crisis care and disease care. That's fine, but once again, I don't know what the expression is about prevention is better than cure. And one of the other things I want to have a look at is from a user experience point of view, it's very difficult to hand over the responsibility to the patient or to the person involved in the program, because they tend to people don't change easily by themselves. So it's good to have accountability groups, and people work very well under peer pressure or in a group environment. I mean, we're tribal by nature, and we're always concerned about how the tribe is going to see us. So we tend to make changes there so that we look good. That's another way that we can get people to do that. When we have a look at how people are interacting with online information, and from a user experience point of view, it's all going this way. We've got to be very careful, because when people fill in the forms or do their discovery vitality assessment, I will tell you there's very little accuracy or truth in that. And to then get people to be truthful in their forms is once again difficult. If a person, like if I have a look at some of my family members, they drink a lot of alcohol, and there's no ways that they're going to be truthful in their assessment. So it's always amusing. I mean, I've been there, I've had a look at that. I mean, I haven't been drinking now for 4 years. That's a whole different thing. I didn't do it necessarily from a health perspective. I did it from a spiritual perspective. But seeing that people are not truthful in this interaction. So that's once again a challenge, because we're dealing with human beings. And that's a major thing, like moving forward with how people are going to be using wellness care in the future. Those are the major challenges I see. Now, they're major challenges because I'm having a look at it's very hard being a perfectionist, because I have very high expectations on getting things right with my patients, with these programs that I have. So I haven't noticed that I don't get 100% success rate, but are we moving the needle? Are we changing things with a few percentiles a month? And that's definitely yes. One of the great things is, once again, as a user experience, human beings like face-to-face interaction. Right now, people haven't got over the challenge of interacting with a machine. So that'll be a challenge. Are we going to ever get to the point where we feel comfortable sharing things with the machine? It'll probably go that way. But we are definitely making shifts in the right direction with all of these murky things that I've been talking about. So there definitely is at least hope. We're getting these people to shift, and they come from a whole different array of socioeconomic backgrounds, so and personality backgrounds as well. So regardless of that, are we going to make huge shifts? Unlikely, because the inertia, the way that this huge ball is rolling forward. Firstly, that people see the medical fraternity looking after them, and that people are very stuck in their ways. You know, we do things that our parents taught us what they did. People always eat the same way that their parents ate, and that's how cholesterol and blood pressure are familial. They're not necessarily genetic, but people eat the same thing their parents did. So if a parent has high blood pressure and is overweight, the odds that the child is going to be like that is between 80 and 90%. So we still are making changes, but I really think that moving forward, the greatest way, if we're looking at really looking after the health of the country, most of the time, the money, the energy needs to be spent on prevention. And it's simple. Those three things: eat more vegetables, get moving, and remember, we're not prescriptive about it. We don't want people necessarily running marathons. There's so many ways to eat vegetables, exercise, and then manage a person's mind. So that's pretty much it. Those are the simple things. Are they easy? That's also different. No. But if we can make little shifts each time, then we can definitely progress. But it is going to be interesting to see how people can move with this. Having a look at the economy. Once again, there are two things to that. Firstly, is your health worth it? You know, people they moan about the cost of healthcare, but then are very happy to spend 1,400 Rand on a pair of shoes. So it's all about where a person's priority is. And the second thing is eating healthy is a lot cheaper than chemotherapy. You know, I don't like saying that, but, you know, disease, you know, if you have a look at managing a chronic disease, it is very expensive. And people say to me, oh, well, my medical aid pays. That just means that I'm paying for their irresponsibility. No, it's not like, oh, but my medical aid covers it. No, I pay medical aid. I pay for people's illness because I'm quite low risk from a health perspective. But all of these other people are paying the same base medical aid rate as what I am, but I'm not using those, and I'm sure as hell want to make sure I don't. But healthcare is, or should I say, crisis care and disease care is very, very expensive. So compared with organic food and really healthy food, it's a difficult question. The same as most healthcare, it's like a grudge purchase. People come to me with back pain, and it's a grudge purchase. They don't come in there going, yay, I'd love to come for you to help fix me up. Wellness is different, but it's a grudge purchase. So also, like, if I can find, that's why fast food is it's a big challenge. When we have a look at not the pharmaceutical industry, the agricultural industry, all the foods that are made cheaper, and the farmers that get the payments and all the not substitutions, the farmers get financial kickbacks for growing all the cheap crops, and those are all the unhealthy crops. If you have a look at corn in the States and mealies, all of those guys get a hell of a lot of support, and those are the things that go into everything. If you look at high fructose corn syrup, it's one of the banes and the most unhealthy thing that gets put in most foods. So that is a challenge from an economic point of view to get real wholesome food at greater costs. But the people are moving more in that direction. So it's a difficult question there. Okay, so unless there's anything else, I just hope this has been informative. It's definitely has the potential to ruffle a few feathers, because I believe the the present model isn't working. If you have a look, people are getting sicker, people are dying younger. We've got phenomenal medical interventions, I get that, and it's helping people stay alive, but we really need to be having a look at cause from a user perspective and how we can have a look at getting people, preventing all of these unnecessary points of suffering. So I hope we get to interact a little bit more. Thank you very much for listening. And if you want to get hold of me, my website is enspire.co.za. That's enspire.co.za. Thank you for listening. Like a wellness PA, so that a person can be like, geez, Brett, I'm